We're day 2 here at the Texas Association of Value-Based Care Conferences, and actually had the opportunity to meet Dr. Paul Shields from Vantage Hemp, a pretty unique and novel, innovative idea using pharmaceutical-grade CBD therapy for patients. So, Dr. Shields, thanks so much for joining us, and tell us a little bit about what you're working on.
So, CMS came out with the opportunity for ACO REACH participants to enable the Benefit Enhancement Initiative on substance access. And with that, they said that patients can access CBD products as a bridge or supplemental therapy to reduce avoidable spend and efficiency. Well, how does that work? It works around a very disease-specific indication. So if you look at conditions like generalized anxiety or chronic pain, chronic neuropathic pain specifically, a lot of those patients are out being managed by contemporary therapy, but they aren't to the point of symptom elimination. So they still have symptom complex, but they're maximizing their therapy with readily available treatments. By adding CBD as a bridge therapy, we can get patients better symptom control, reduce their symptom burden, and reduce avoidable spend. So avoidable ER utilization, avoidable admissions, polypharmacy burden. And in cases like peripheral neuropathy, we're able to improve their function and then prevent falls and avoidable injury, which then creates significant cost. What Vantage Hemp is able to do is produce a pharmaceutical-grade CBD isolate that allows the prescriber to know that when the patient's getting 20 milligrams or 30 milligrams of CBD, they're getting that every time consistently, and we can get to a point of really objectively titrating dose and knowing that it's working. The alternative is nutraceutical grade or going to a dispensary, and the product that you're getting then isn't able to be verified in most cases. So we have the ability through a certificate of authenticity and through third-party testing to assure through CGMP processes at our pharmaceutical grade production that you're getting CBD, pure CBD, without the adulterants, without the contaminants, every time consistently.
I love that. And it's interesting because I think one, having the pharmaceutical grade, two, being able to truly understand the dosage and create that consistency. From a population perspective, neuropathy is such a big concern for so many different subtypes of disease states. Where do you see this fitting best? Is this kind of a larger, broader scale? Do you have some test markets? Where do you see this model evolving?
So we think from a disease standpoint, chronic peripheral neuropathy, whether it's related to diabetes, oncology related, so infusion chemotherapy related neuropathy, or patients who have chronic pain that isn't necessarily neuropathic, but is persistent in the pain generation, there is an opportunity for CBD to augment that pain signal and improve the outcomes there. CMMI, this program around CBD, allows enhanced oncology model participants and ACO REACH participants, so that the isolated entity is really around those risk-bearing entities. But from a disease standpoint, using it around chronic peripheral neuropathy that's related either to diabetes or in the chemotherapy, one of the big opportunities, you say, well, how does starting another treatment reduce cost? So if you look at patients who have chemotherapy-induced neuropathy, for example, some of those patients are missing treatment schedules. They're showing up in the ER to be treated for pain because it's after hours or it's on the weekend. If you get them to a point where their symptom burden is reduced to where they're not needing additional care, or they feel well enough to be able to attend their sessions and receive their chemotherapy, their longitudinal journey on their primary diagnosis, their oncologic diagnosis, is more fulfilled, and they're not going to the ER for other conditions related to that. CBD also, because of the nature of how it works in the endocannabinoid system, improves sleep hygiene. It improves anxiety and reduction anxiety related to whether it's the disease condition or the chronic symptom that they may be having. So there's an opportunity very broadly with one new treatment to reduce symptom complex that drives patients to receive extra care. Generalized anxiety patients have 2 times the spend on average as a non-generalized anxiety patient. They somaticize symptoms, they show up in the ER, they show up in urgent care. By reducing symptoms, they have less of a generator to then go seek unnecessary care.
Okay. So then how does this work? So from the benefit design, like how does that work from a cost versus a reduction in total cost of care expenditure? What makes sense for you in the model and kind of what you guys have evaluated?
Yeah. So CMMI says that the patient has to be provided the CBD through the entity, whether it be the ACO REACH or the EOM model. So what we would propose in the plan is that you would be able to either white label the product and dispense it through your ACO. So if you were ABC ACO REACH, you could have ABC CBD brand that we would be able to brand and label, and you could dispense directly, or you would enroll patients in it and we would be able to ship it to them direct to consumer. That's one ability to do this. The realization is it's almost like a pre-funded opportunity. So the ACO, the at-risk entity, would pre-fund that spend up to $500 a year and then be able to reconcile that through the final reconciliation of total cost of care. So when you look at it, if you take 100 patients in your ACO that are high spend, you put them into this and every one of them qualifies and stays on it, you have a $50,000 spend. One fall with a hip fracture, you've recovered all of that.
Absolutely.
So the reality is the ability to get to ROI is really pretty easy. The benefit, at least from my standpoint, in my past life, I ran an ACO REACH model in upstate New York. The benefit of this is we're not pitching this as a shared savings. We're not taking a percentage. Every opportunity for the ACO, the entity, to realize, to generate shared savings, they keep. The only cost is on the product. You say, well, why? That sounds too good to be true. Why do I want to do this? I'm looking for a partner or multiple partners that we can then curate real world evidence. So what we want to do and what CMMI wants to do is they want to show in proof of concept that CBD reduces avoidable spend and reduces cost by using this. We need patients taking this in a controlled fashion to be able to generate that data and curate it. It's really a first to market. It's an innovative program. You know, there almost is no, it almost sounds too good to be true, but it is.
I love it. Yeah. Well, and I want to talk about what's next, but before we do that, as you're talking, one of the things I'm thinking through is how does this play a role in polypharmacy, deprescribing? Yeah. Is there opportunity there? Because that's always one of the areas we focus in terms of our name brand utilization, generics, polypharmacy, bringing in the PharmDs. How does that all play a role?
So there is real opportunity there in the fact that if you take these patients, and we'll take peripheral neuropathy again. So if you look at most peripheral neuropathy patients, they get started on gabapentin. If they fail gabapentin, they get put on Lyrica. Most of them are on an opiate as well, so they're on a Norco or an oxycodone. And a lot of them are on an SSRI or an SNRI, so they're on Cymbalta or Effexor or something else along with that. Those patients, with the ability to get better symptom control, now you have the ability to start deprescribing. So the same way those got added, we would recommend taking them away. So as you have a patient that's on, say, an SNRI for that, when you look at CBD and its mechanism of action, it's in there binding to the 5-HT1 receptor. It's inhibiting the breakdown of norepinephrine. So really working along the same pathways. So you would suspect that with better control, you could start reducing the SNRI, the SRI. Lyrica, for example, $385 monthly spend accountability. You're talking about adding a $30 a month product in CBD. So there's real opportunity there. So if your organization is at risk for the pharmacy spend, there's opportunity to get to that deprescribing piece. And the opiates, of course, opiates have really no place pharmacologically or physiologically in chronic peripheral neuropathy, right. But we use them a lot because patients come in complaining of a symptom, we take our pen out, we write a script, and boy, if we can block a mu receptor, maybe we're getting somewhere, but that's not the mechanism in neuropathic pain. So definitely a path to getting rid of the opiates as well.
I like it. Yeah. Well, and so then circling back, so you talk about a low cost investment for the entity, but high return in that they're keeping the shared savings. And hip fracture is a great example because of just the pure cost. So understanding that you're looking for a partner from your perspective, or maybe some of the things that you're currently working on, like what is next? Like, is this something where you guys are looking at partners and trials? Is this something where we're past that phase and we're just looking for adoption? We're looking for adherence? Like, where are you guys at in that cycle, and what does that future cast look like?
First phase is really adoption and implementation of the program, and we have the ability to work with ACO REACH entities and EOMs in getting the implementation plan. So we have the ability to help support that, curating data and reporting requirements through 4I with the organizations. But next phase is really looking to broaden that clinical indication. So we're really comfortable now with generalized anxiety and peripheral neuropathy. But we think there's some other places and paths that we could see this look. So if you look at some of the high needs or special needs ACOs around long-term care, there's a real opportunity around long-term care with patients with cognitive deficits and behavioral changes, sleep disturbance and appetite reduction. CBD has a nice fix there to really kind of supplement the multiple treatments. And I think there's a bridge there and an opportunity from a cost savings. But initially, it's really finding that first 100 patients that we can prove that there is value to really start reducing that avoidable spend. The benefit of this, and if you look, and I've heard today at the conference and yesterday a lot of talk around access and lead and all the other models coming out, and what we want to do is start helping the governmental payer start to proof of concept. So if that works the way that I anticipate, and if I pull my crystal ball out, CMMI in January is going to say, hey, we showed that this worked, and now we're going to broaden this to really all comers across traditional Medicare, across the MA space. So I think there's opportunity to really say we were, kind of first to the market on this, but the market really starts to open up when CMMI can pat themselves on the back and say, we got this right. CBD reduces avoidable spend, and hey, the rest of the world should be on this.
I like it. Well, and I think too, as you talk about the different subsets, so I think EOM is a great pruning ground. I think there's some significant opportunity there. Obviously, diabetics is going to be another opportunity. Long-term care, I think, is from an institutional patient perspective, is a great opportunity as well. And so, talking about currently within REACH and kind of looking into the transition over to LEAD, that's going to be able to carry over in terms of the benefit design. And so now it's really finding the right partner, being able to do that proof of concept, being able to pull that data and then use that to scale across the continuum into other areas and other opportunities.
Yeah, really. And I think this is the tip of the iceberg. It is really one of those things. And the irony of it is if you start talking to patients, a lot of them are already getting CBD. People are out there using it and they're doing it. The problem and the win here is we can guarantee that you're getting that CBD in the right concentration consistently and reproducibly. Folks that are getting now are buying it off the online and getting it at the health food store and everywhere else. And really the product consistency just isn't there. So you have that high rate of failure in patients who maybe weren't even getting CBD concentrations in the product. So now they're saying, well, CBD didn't work or did work. So I think there is a real opportunity in the pharmaceutical grade. The ability to produce this with consistency and validity is really the value. I find it ironic in the fact that I almost feel like I'm pitching this great novel concept. I'm just trying to help CMMI support it. They created this. They said CBD. They lined it up. And then from an ACO operator, you say, well, where do I get that? Like, I want to do this. Where do I go get that? We're the only manufacturer of pharmaceutical grade CBD in the country. So we're the ones that can do it. And if you want to move down that path to really be innovative and creative, we'd be happy to support you and provide that product.
You're like Mr. Wonderful, all roads lead back to
Mr. Here it is. That's how they kind of opened the door and started it. We're just trying to support it and be an enabler essentially for those folks who want to go down that path and meet CMI's kind of push.
Well, in interesting times for sure. I think there's certainly opportunity. I'd be excited to see where this goes. What's the delivery mechanism? So right now, is that a pill? Is that other forms? Is it, you just talked about topical lotions. Obviously, I think for this is probably more pill form, but what does that delivery look like?
Yeah, so we have a roll-on, the topical cream application. We have a vegan gummy that you can chew, a chewable essentially, an oral tincture, and a capsule. CMMI, the restriction is it cannot be inhaled. So no inhaled products. But other than that, it's really able. My preference from a pharmacokinetics, pharmacodynamic standpoint is the tincture, the oil that you drop. That you get about 20% that bypasses first pass metabolism, so you get sublingual absorption. Then you get the GI absorption, so you get a little more steady state in leveling. If you had a focal area, if you said my knees are really the problem, I would prefer the topical application there because then you don't get the systemic effects necessarily and it's just as well absorbed and producing for local effects. But if it were generalized anxiety, the oral is really going to be the path.
Yeah. Well, this has been great. I tell you, value-based care is where innovation happens, and I hear new, novel, interesting things all the time. This one certainly stood out to me. from your perspective, anything that we didn't cover, anything you'd like to share with the audience?
No, I really appreciate the opportunity. And I was telling my partner, a lot of times I feel like I'm preaching the gospel and proselytizing and going around, but it really is one of those things. And as a clinician, I just want to get it out to where the patients, because we talk about from a value-based perspective, we're saving money, we're reducing utilization, we're doing this. But the real key here is we only get to that when patients get better.
Right.
And that's really what drives us back. So we kind of kill all the birds with one stone.
I love it. Well, we're all aligned towards outcomes.
Yeah.
That's where I think this model has to go is outcomes. And so it's outcomes over inputs, but this has been a really phenomenal conversation. So Dr. Paul Shields from Vantage Hemp. And how do they get a hold of you?
VantageHemp.com or pshields@vantagehemp.com.
Well, thanks so much for the time. Super intriguing for me and excited to follow the path. Excited to see where this goes. So thanks so much for joining us.
Pinnacle is your partner in the business of healthcare, nationally recognized for helping clients manage risk, improve performance, and drive innovation. For more information, visit our website, askphc.com. For more information on our guest or to learn more, please visit their website.